Good morning, Dr. Piette. It's a pleasure to meet you, and thank you so much for taking the time to come out and speak with us about how teaching and learning has evolved during the pandemic.
It's a pleasure to talk with you.
Awesome. So let's start by having you introduce yourself, tell us about your role, your research, and how you've been creative and innovative in terms of teaching in the pandemic.
Sure. I'm a professor in the Department of Health Behavior, Health Education here in the Public Health School. This semester I'm teaching two courses. One is about survey methods, so teaching students how to use surveys to really get the voice of different communities and understand risk factors better. And the other course I teach is really about interventions, like how we can have more effective conversations with people that need to make a behavior change around something like drug use or alcohol, or maybe they're struggling with their mental health problems. So we are back in the classroom, and that's a big change for us. I mean, I taught online like most people last semester, so that was all Zoom. And now we're all in person, but we're in person with masks on.
Yeah.
So, welcome to 2021 in the pandemic. But that's good. And, I've talked to a lot of students about that experience. And even though we have masks, and even though there is the risks and all the challenges of social distancing, people are glad to be back.
Yeah.
They're glad to be in person. It feels a little more connected with people, and that's a good thing.
Tell us how teaching has evolved in the last year.
Yeah, I mean, teaching has changed a lot. No big surprise there. One of the main upsides, though, is that this whole process and being online has kind of opened up this whole new world of bringing in people, of course, by Zoom or these other technologies. And for me, what that really means is bringing into the students' experience people in my network that are maybe not in Ann Arbor, maybe not even in Michigan, and often not in the United States. So I've had people be online and speak in my classes who are working in communities in Bolivia, working in communities in Honduras and Central America, or around the world. So now we can do that, and it's a little more natural to contact people at the Michigan State Tobacco Quit line and ask them, sure, anybody can do a 45-minute Zoom call. It would be a different thing to drive down to Ann Arbor. So, that just opens up a whole new world of bringing in context for students, and I think it's really enriched their experience.
So some of your research has to do with global innovation around chronic disease self-management support. Tell us a little bit about that and how students are coping, and what advice do you have for our students as we continue to navigate this pandemic?
Yeah, it's really interesting. In the issue of chronic disease self-management support, we've been focused on communicating with people at a distance for a long time. So with the pandemic, of course, that's only 10 times as important as ever when patients are really concerned about coming in for in-person visits. The other big change, though, has been an increased emphasis on mental health and substance abuse. Those things have increased as public health problems, both in the United States and around the world. And so that's become more central to what our research is. The good news is that there is more evidence than ever that we can communicate with people at a distance, and that those sorts of interventions are often at least as effective. We're trying to give students the skills that they need to be effective communicators. So that might be online, it might be through a Zoom call, it might be communicating with community-based organizations in other ways. But there's certain communication techniques that we know work. And those are what we're trying to give students a chance to get some of that experience.
So, Dr. Piette, thank you so much. Before I let you go, do you have any parting advice or guidance that you can give to our community?
Yeah, a couple of things that I think of when it's specifically thinking of advice for our students, sure, for our faculty and staff as well, but mainly for our students. A couple of things. One thing that we know is that when things are tough, when people feel out of control, we need to check our thinking. Like, we often have unanalyzed, unexamined, what they call distorted thinking, distorted thought processes. I got this worse than everyone else. No one is struggling in this class like I am. Everyone seems to understand this but me. Those sorts of ideas can make us feel really lousy, and they're often not exactly correct. So it's good to kind of keep that in mind, that just how we're perceiving things might not be how things actually are. The other thing I would say is, again, like central to this whole experience is feeling out of control and helpless and really like there's not much we can do. So we have an amazing opportunity here at the Public Health School and at the university more generally to learn skills. I mean, we have some really powerful things that we have to offer our communities, our country, and the whole world. So focusing on those skills, I think makes people feel more empowered and like they have a role. So I'd say focus on that.
So, Dr. Piette, thank you for taking the time to speak with me today. I also want to thank all of our tremendous faculty for helping us students out during this troubling year. And as always, go Blue.